Hello friends, today we are going to talk on a cosmetic procedure in which various rings, studs or pins or sometimes some crystals have been pierced in your lips or cheeks area, on the eyebrows or inside the mouth. So all this cosmetic procedure which is done to enhance your beauty, to give you that very cool and fashionable look. So this is nothing but oral piercing. So oral piercing is one new trend which has come up in the past few years. But if you're following that, you should know what can be the causes of it or what can be the dangers which are involved along with the oral piercing. If you have a few piercings already in your oral cavity, then what is the care that you should be taking? Come, let us have a look at this video.
Subscribe to my channel and get information on dental health and dental facts.
Hello and a very happy morning to all of you. Here you are on my show Monday Mornings with Mansi and my YouTube channel Dr.Mansi Shah. Friends, today we are going to speak about a new style statement. But can this new style statement be dangerous? Oral piercings. What exactly is this? I am going to purely speak about the intraoral oral piercings. That is the piercings which are done inside the mouth, on your lip, tongue or gums, and sometimes on the palatal regions also. So all these oral piercings, how are they dangerous? Come, let us have a look. So this oral piercings, for the first and the most thing that it can cause is whenever they are pierced somewhere, they cause friction and rubbing of the tissues on the opposite side. Like if there is a piercing on the tongue, then rubbing on the upper portion of the palate or in the areas where the tongue is moving. So it causes friction and roughness on the surfaces opposite to the piercing. Then also the most common is speech and eating difficulties. Obviously, if you place anything in your mouth which is going to be permanently there, it is sometimes even pointed. So all this, it will definitely going to be an hindrance to your talking abilities and your eating capacities or eating abilities. It is going to cause you difficulties in your eating. Then later on, few people say that they get used to it, but yes, they are going to be there. Then because of the food that you eat, and if you keep it unclean, there is food particles that get lodged in. Then there are bacteria which sit on this metal or on these things, on these rings and studs. When these bacteria get lodged in, what happens is infection, inflammation. There is redness, swelling, pus discharge. There is bleeding that takes place. Yes, it is an awful thing. Many times after the infections and inflammations, you will have to undergo removal of these piercings, and it leaves back a very bad, unsightful, odorful scar. Also, because of the studs being inside and you're not keeping proper oral hygiene, there is a bad odor which comes along. Then more of plaque and calculus accumulation can cause cavities in the teeth. Also, if the stud or the ring or the balls which have been placed on the tongue or the lips, they are large and they are hitting on the teeth or continuously causing an injury, there can be fractures of the teeth also. Then because there's something inside in the mouth, there is continuous more formation of saliva and there is drooling that is coming out of your saliva, more saliva is being produced and spit out of your mouth. And the next risk that comes along is because especially in the tongue region and in the lip region, which are highly vasculated, that is, they have maximum nerves and blood vessels. So once you pierce something inside, there is more of bleeding that is taking place. If the bleeding is not controllable, it will leave behind an unsightful scar, plus the stir will not stay long. Then if in the tongue areas, if you pierce on some nerve by any chance, that like if you go to a piercing person who does not have knowledge of this nerves or the placement of these nerves, and he by any chance pierces the nerve is pressed, compressed, there is permanent or temporary loss of your sensations, which is called as paresthesia. So loss of sensations in that area can also happen. Then rarely, but yeah, this is also a thing that if the piercing goes loose and you do not tighten up in time, you can swallow that inside. The metal which is being used for these things, if it is of no good quality and not properly sterilized and used, then you have chances of contracting sexually transmitted diseases like HIV, AIDS. Also, some other blood diseases can take place. Blood cancers can also happen if this is not taken proper care of. Now, if you already have some piercings in your mouth, what can be the treatment option for it? I would still say please do not undergo any piercings, but if you still have them, right care is a very much important step. You should keep that piercing area very much clean, wash it off after every meal, then at least once or twice in a day with warm water and salt mixture, rinse your mouth properly. Use mouthwash so that you can easily fight the bad odor. If you have any infections or inflammations in that area or you have any scars, no kissing or touching. No touching your piercings with unwashed and dirty hands. Make sure you do not invade any bacteria inside. Please do your piercings from a certified piercer who can properly with knowledge do this technique or do this piercing. Please do not visit anyone who does not have knowledge about it. Then also, with some piercers in the early few months, you should avoid sharing your cups and plates, or if you have got some infection, body infection or infection in that area, please do not share your cups and plates. Wash them separately so that the infection that you have got is not spread to other person. Restrictions are always going to be there according to the speech and in your eating habits. So whenever you're eating, make sure you make small bites or morsels, take small morsels of your food and then you eat it. Avoid too hot and spicy food lifelong. Yes, because this is what is going to damage or cause more harm to the tissue. Also, if you have certain piercings which are loose, which are infected, please make sure you visit a proper dentist or ENT surgeons or the oral piercer for this matter. Get the piercing removed, clean that area properly, take the required medications and please do not redo the piercings. Yes, I know that this is a new style coming up and many of them around you must have been going or undergone this procedure. But is it really important? Is your style of that importance that it can come at the cost of your health? I don't think so. So before undergoing any piercings, think twice. Make sure that you share this video all among your young friends and make them aware of the oral piercings and make them aware of how dangerous can these piercings be. So please definitely like, comment and share to this channel, Dr.Mansi Shah. I come up on every Mondays and Thursdays with dental related issues and tell you some facts of dentistry. Please do show some love and subscribe to this channel. Till then, stay healthy, stay happy and be aware of it. Thank you.